Healthcare technology.
Healthcare technology.
Healthcare, people care.
What the Affordable Care Act has done is opened up ways for people to get access to buy insurance, but has also encouraged people to start thinking a little bit more responsibly about how they pay for it and what kind of ways they can save money. So the tech is it's a sweet spot that not a lot of people have found. There's a lot of people doing telemedicine. There's a lot of people doing private exchange and creating very smooth portals, great user experience. What we found is there's nobody really bringing the buying and the care decisions together, and our portal allows people to come make sure that they're covered, so they have the actual insurance piece of it down, but they're also clicking into a telemedicine screen and they can see the doctor face to face right there. They're able to look at all their surrounding providers. They can see on a map where the closest dentist is and get cash savings right there online. So the tech is really bringing a pretty complex array of decisions into a really simple process where people can get the care they need and the insurance to cover it. So what we're encouraging is individual responsibility. We're saying by the right level of care and by the right level of access to the insurance in the first place, and it really starts to make a lot of sense where people are making better, more informed decisions.
Genopedia is a genetic search engine, the first ever in the world that's capable to search out lethal mutations that might kill individuals or children. On June 23rd, 2014, my son died from a genetic mutation in his RYR2 gene. The whole reason we started Genopedia was to make sure that this never happened to any other family again. All the technologies currently exist to have saved him. The problem is that genetic testing produces a lot of false positives, and those false positives can lead to unnecessary testing. So really the entire field of genomics needs to establish clear results that clinicians can use to save people's lives, and that's what we're working on. We're already working with the University of Rochester Transcriptomics and Integrated Genomics Research Group, and we're working with RIT's Bioinformatics Department. So locally, we're very well connected, and we're starting to reach out to University of Buffalo and the Center for Excellence in Bioinformatics and Life Sciences. We just need to continue to grow like we have been organically, meeting more people, telling our story, showing the tools that we have available, and I think just through word of mouth and organic growth, we should be able to get full market penetration. Healthcare should make living life better.
Healthcare should work. We make it so.
Healthcare technology augmented by a community of caring people.